Welcome to Healthcare for the Homeless. This is our Fallsway clinic, the largest of 5 sites in Baltimore. Come on in. We were founded in 1985. I moved into this facility, which we built from the ground up in 2010. So we've been here about 13 years. If you were coming for services, this is where you would check in for an appointment or a walk-in and be seen by one of our client services representatives. We're checking insurance if you have it, finding out who you're seeing, helping to direct you throughout the building. All of those we see are seen without regard for ability to pay, and a growing percentage of our clients these days are completely uninsured. Here in the waiting room, you're seeing set up over the last 3 years for a pandemic with chairs spread apart. If you were here in 2019, you would have seen all of the chairs tightly fit together, and this was still about standing room only much of the time. Like most Healthcare for the Homeless projects, we experienced a dip during the pandemic, and that volume is, of course, starting to come back up now. There are a series of rooms, one where we have our art group that meets regularly. You will see all throughout the building on the walls art that was mostly created by our clients, by people experiencing homelessness. Over here we have a dedicated suite for enrollment, where we try to enroll people into public benefits that they might be eligible for. All the way down this hall and around the back is our supportive housing suite. We have a growing number of staff members that help sustain people in permanent housing and off the streets. Indeed, that's the best way to improve the health of those that we're working with. And connected to the building in this front corner is an on-site pharmacy operated by our partners at Mount Vernon Pharmacy. We've collaborated with them and run our 340B program for the last couple of decades. When we built this building, they said, hey, we want to start a satellite pharmacy right here co-located with Healthcare for the Homeless, and that's worked out very well. All right, let's take the elevator up to the second floor. Healthcare for the Homeless was founded in 1985. We were one of the original 19 Robert Wood Johnson Foundation grantees. We were incorporated as a nonprofit a couple of years later. And of course, the Robert Wood Johnson Foundation program was used as the inspiration for the federal Healthcare for the Homeless program established in 1987. You got it. This is the largest of several clinic sites. We have smaller clinics in West Baltimore, a mobile clinic that visits Baltimore City and Baltimore County, a standalone respite care or convalescent care program on the 3rd floor of the city's largest shelter, and a standalone dental program inside the city's largest soup kitchen, our Daily Bread. Hello. How you doing?
Hi.
This is the 2nd floor where most of the clinical services for adults are integrated. Again, you'll see evidence of art on the walls used throughout the building. Like spokes on a wheel, each door heads to a different clinical area of the building: medical, mental health, and social work, addiction treatment, dental care. Our psychiatrists back along the far wall. And then all of those services are integrated in this central atrium, where we've tried to bring as much natural light as possible into the center of the building. Let's head this way. You're here on a Thursday afternoon, so our clinic is closed to clients. We do interdisciplinary case conferences and team meetings. This also lets us show you the building without violating any client confidentiality. Let's head this way. Agency-wide, we have 240 staff. About 200 of them are located here. The exam rooms should look like exam rooms, completely wired with electronic health records. We have 3 of these wings or pods. Each one contains 4 exam rooms and an interview room, which is increasingly used for clinical purposes, also to bring in other disciplines to integrate care. All of our clients are empaneled on a multidisciplinary care team, which includes medical, mental health, social work, community health workers, and so forth, working around a panel of patients. So we're not asking our clients to navigate 200 people throughout this very large and expansive building. We're wrapping care of about 10 to 12 people around them so that they can get access to all the resources they might need. We have an on-site lab, which is staffed at their expense by LabCorp, which is one of our closest lab collaborators. When Medicaid expansion happened in 2014, most of our clients became insured, and LabCorp agreed to provide an on-site staff member to draw labs rather than having our clients walk 10 blocks away. It immediately increased access to the labs that we order. 97% of our clients get their labs. Those lab results come right back into the electronic health record. And then LabCorp also is kind enough to draw the labs of our clients without insurance as well. This wing of the building of the medical clinic has increasingly been used for walk-ins and medical triage. We used to do that triage work on the first floor of the building. During the pandemic, we brought it up to the second floor to try to deconcentrate the space as much as possible. And this has worked very well to operate a walk-in clinic with a waiting room set aside in a former group room space. During the pandemic, we couldn't operate a lot of groups. Those groups are starting to come back now. But it allows us to have a waiting room, do walk-in services in this particular corridor, and then the other 2 are reserved for appointments. This corridor here, where you can see we've also tried to bring in as much natural light as possible, is where you'll find addiction counselors, social workers, mental health therapists. Indeed, our medical services occupy a relatively small portion of our overall footprint. The majority of our services are in fact behavioral health services. This is also the wing where we have provided our medication-assisted treatment program. That program is a very intensive program engaging vulnerable people into buprenorphine, Suboxone. We then transition their care to a provider that can manage that care on an ongoing basis. We also launched during the pandemic Maryland's first syringe services program within a community health center. So someone doesn't have to line up at a separate van or go to a site that is only administering needles. You go into an exam room. If you have diabetes and are insulin dependent, we're going to provide needles. And if you have an addiction and would like needles, we're going to provide needles. And that program now has been going strong for a couple of years and only growing. We are fortunate to have 4 full-time psychiatric physicians, psychiatrists and psychiatric nurse practitioners down this corridor. We were able to build that even prior to Medicaid expansion. Maryland did a phenomenal job providing outpatient mental health services even to people who were completely uninsured, allowing us to build that program. As we moved into Medicaid expansion with more of our clients insured through Medicaid and Medicare, we've been able to grow and sustain that program. And now, even as last year we saw an increasing percentage of people without insurance, we're still able to sustain access to psychiatry. When we built this building, we had a very strong relationship with a group called the Maryland Society for Sight, which sent volunteer optometrists and ophthalmologists to do vision screenings for our clients. That organization is no longer in Baltimore City. However, we continue to have relationships with area healthcare providers that send interns and staff to do vision screenings. So you see that happening here in this room. And about 6 months after we moved into this building in 2010, we opened Maryland's first comprehensive dental program specifically for children and adults experiencing homelessness. Very pleased to report that last year the Maryland General Assembly finally expanded Medicaid coverage of dental care. It's a 4-chair dental operatory. Thanks to public grants and private supporters, we've long been able to do partials and dentures, so restorative care as well as access to cleaning and general dental care. Now with Medicaid expansion, we are eager for the breadth and depth of our services to continue to expand. The service that was probably hardest hit throughout the pandemic was dental. Of course, because it's an aerosolized procedure, we shut down dental services altogether in 2010, opened them very gradually and primarily for emergency purposes, and now we're in the process of strengthening our staff and reopening our dental operations, not just here at Fallsway, but we also have a dental clinic in our West Baltimore clinic and in the standalone dental program at our Daily Grove. When we first began operating in Baltimore, only about 3% of our clients identified as Hispanic, Latinx, Latine. These days, more than a third of those that we're working with do. And so we've had to ensure that our signage, our materials are bilingual. We've done an effort to establish a method of testing Spanish proficiency and actually compensating staff through a pay premium who are able to administer care in Spanish. And we've increased significantly the number of staff that we have that can deliver care in 2 languages. And here we are on the 3rd floor of our Fallsway building. You can see the atrium where we try to bring in as much natural light as possible. It goes down to the 2nd floor that we just visited. When we built this building in 2010, this area was mostly administrative with some future space, what we called our build-out space, that was going to be way, way, way in the future because we had so much room to expand. We very quickly filled up the building, built out the build-out space. So there's no floor of this building these days where clinical services are not being provided. We're using every single inch of this space. About 25 years ago, we began working with children and their families experiencing homelessness, primarily by sending social workers and nurse practitioners out of the clinic and in the community. We began seeing more and more children and families, and so launched shortly after moving into this building in 2010 an on-site pediatric and adolescent program, which has only grown since then. This is the waiting room. We have 4 exam rooms, and staff continue to engage family shelters throughout Baltimore and build the clinical practice here. Just earlier this year in 2023, we launched our first on-site OB program. So in partnership with Mercy Medical Center, which is the large hospital just across the street from us, and really the hospital that helped create the original Healthcare for the Homeless program in 1985, we contract with them to send an OB provider here. And between that OB provider, our own family practitioners, we provide a clinic focused on OB every Thursday. We just earlier this year had our first baby born from this program, and the babies are delivered at Mercy Medical Center. The rooms are set up in two ways to serve younger children, and then to serve older children, adolescents, a growing number of teens. We've historically served those two primary groups, those 5 and under, and those 13, 14 and above. Although that has been changing as we see more and more entire families, and we are able to serve the entire family. We're on the 3rd floor in what was the build-out space of 421 Fallsway. Looks like the rest of the clinic now. Group rooms where we do support groups, addiction treatment groups, yoga group. You can see a Black Men in Healthcare Affinity group. That's actually for staff that's using this particular space. This area is primarily staff that work out in the community. Supportive housing staff, outreach workers, community health workers that have a place that they can come back to. Our housing services program is very much built on a housing first paradigm. We started implementing this in 2005 when we helped 30 people living in a downtown park that the city wanted to shut down the encampment. We helped them move into their own apartments, provided intensive services. A year later, everyone was still housed and their health had improved. That planted the seeds of a growing program that now exceeds 500 households. And last year, Healthcare for the Homeless created HCH Real Estate Co., a wholly owned nonprofit corporate subsidiary under the umbrella of Healthcare for the Homeless to contain the inherent risk of our housing development work. Just last year, we opened Sojourner Place at Oliver in partnership with Episcopal Housing, 70 units of quality affordable housing, 35 units for people exiting homelessness, and 35 affordable at 50% of area median income. So working to prevent and end homelessness in the same project. That project became the first low-income housing tax credit program in Maryland to finance the essential supportive services. We have 2 on-site social workers to finance that through the development deal itself. We've been looking at a variety of ways through a Medicaid waiver and through the construction process to finance those services that we know are so essential. And both our housing development work and our supportive housing services, we anticipate will continue to grow. A couple of years ago, we really began to differentiate outreach and community health work. Our outreach workers are really focused on engaging into care people that aren't yet connected to our services. Our community health workers are tasked with implementing a plan of care throughout the community. It used to be that all of those services were really the purview of our outreach workers. And with the advent of a greater understanding of what community health work really is, we've been able to differentiate those 2 functions, and they all have places to sit here on the 3rd floor. This area was originally built as admin space, but as I mentioned previously, our services have grown so much that we have clinical services being provided and program staff sitting throughout the building. So there is really no separate administrative space any longer. Some staff that do outreach and community health work sit here. alongside their partners that are doing administrative work. Our SOAR or SSDI Outreach Access and Recovery Program takes place here on the 3rd floor, and this area connects directly to the back of our Pediatric and Adolescent Program. A little bit about the numbers. This is about just shy of a 60,000 square foot building. It was built to replace a 20,000 square foot building that we moved out of in 2010. The cost of this building was about $17 million, and we, within a year of moving into it, we had completely paid off our construction loan and have no debt on this facility. Last year, we saw more than 11,000 different people, about 80,000 patient visits. Prior to the pandemic, our patient visit volume was over 110,000. That has decreased somewhat, though the number of individual unduplicated clients that we're seeing last year began to increase after the depression of the pandemic years. Throughout the pandemic, we began providing phone-only telehealth services to a growing percentage of our clients. That got up to more than 60% of our visits by telehealth and 40% in person. That began to flip in late 2001 throughout 2002, and now the majority of our services are on site. But we just, in our state's legislative session earlier this year, passed a law to ensure that we can continue providing telehealth services and specifically phone-only services where clinically appropriate. We found that not just during pandemic circumstances, but during all circumstances, reaching people by phone can be an effective way of retaining vulnerable people in care and then getting them back to see them in person when we can. Sure, we should do that. How you doing? This area here is built and designed for staff. We have a staff lunchroom, staff restrooms, a shower and lockers, a boardroom that also functions as a staff meeting room. And it's really key fobbed separately from the rest of the building. So it becomes a place where staff can rest during the day, take lunch, take a break. We also have access to a porch right outside on the second floor, on the 3rd floor of the building, where people can get outdoors when it's not raining. We are here on one side of the Jones Falls Expressway, which is the elevated highway in Baltimore. One of the many highways that separated communities, that were designed to move people from the suburban areas into work in the city. We're structurally racist by design. And we sit now on one side of the Jones Falls Expressway. Every few years, there's advocacy efforts underway by planners to tear it down, as we've seen in other parts of the country, other cities that have demolished their elevated highways. But you can see we are very close to the rest of the city. Mercy Medical Center, one of our closest hospital collaborators, is right across the street. We're 2 blocks away from City Hall, where we spend a lot of time advocating for sensible public policies to actually end homelessness as we work to manage the symptoms of it. Thank you for visiting Healthcare for the Homeless at our Fallsway clinic. We're glad you got the opportunity to take a tour. If you have any questions or would like to know more about our work, visit us at www.achmd.org. And we look forward to seeing you again sometime soon.